So you have been a patient of mine for a long, long time. I've lost count. It's been like 12
It's been
years.
12 years, yes.
Yeah. Well, thank you for that. And we've been through a lot of things together.
Absolutely,
Um,
yes.
Lots of things, more than we can talk about in this short interview. But
Right.
a couple of them that I wanted to chat with you about were, first of all, you had a labiaplasty done with me a long time ago. I think it was in 2010.
It was 2010. I think you hadn't been doing it that long at that
Yeah.
point, and you may have been the only doctor in Houston doing the procedure then.
Yeah, that's interesting. Back in 2010, I was the only doctor, I
Hmm.
think, doing it in Houston. Started it about 12 or 14 years ago, so that was pretty early on
Hmm.
in my labiaplasty career. So we're still seeing each other, and I find that so interesting because you're actually one of the many patients that come back and see me, and I kind of forget that you've had it done sometimes because you can't see any scars, everything looks normal. But if you can remember back that long ago, why did you decide to come and see me about that in the first place?
It was something that had been bothering me for a while. I had three large babies, over 9 pounds, all natural childbirth, and I had started to notice it was uncomfortable getting hung on things, and it really bothered me. But I didn't know what to do about it. And when I started to research, is there something you can do about it? I came across your name, and you were local, and so I came to see you about it.
So, what was it like getting the surgery done? It's a long time ago, if you can even remember, having the surgery done. And do you remember a little bit about the procedure and kind of how it was the first few weeks and months
The
afterwards?
surgery was so simple. It was like almost like having a test. There was really nothing to it. I went home the same day.
Mm-hmm.
Um, I don't remember a great deal of pain or discomfort. I remember basically, I took it very easy for about a week. Ice packs,
Mm-hmm.
that really took care of everything. It wasn't that, I don't remember a lot of discomfort from that
Mm-hmm.
surgery.
Yeah,
It wasn't bad at all.
it's pretty quick
Hmm.
recovery. It's been a while, but a couple of
Yes.
weeks, and we're almost always back on our feet
Yes.
doing most things.
Hmm.
So, how did life change for you after you had that done?
I was a lot more comfortable with myself. Um, just the simplest things. And I don't know if this is TMI perhaps, but just going to the bathroom and you just notice that there's a difference and it's just comfortable. It's not, oh, did I miss something? There's something in the way. It's not in the way anymore.
I've heard that from so many women, just something
Hmm.
simple like urinating.
Yes.
Toilet paper can get stuck.
Uh-huh.
Sometimes even the urine can be deviated this way and that because the
Exactly.
folds fall in the way. And, we just don't have to
And that's
bother
gone.
with that anymore. Yeah.
Exactly. So
Yeah.
it's just, you don't even think about it. After a few months, you're not even thinking about it anymore. So it was just so much easier. And I've always told my daughters, if there's something that you don't like or that's making you uncomfortable, fix it. And this was just a very simple way to fix that problem.
I love what you said about how I just don't think about it anymore
Hmm.
because that's exactly how I experienced when I had my own surgery done, when I had a flap of skin after I had my twins. It wasn't like every day now I look in the mirror and go, oh my gosh, I look great. It's just I simply don't think about it anymore.
Hmm.
And I experienced that as a kind of freedom. It's
Hmm.
just a annoyance that I don't have anymore.
Yes, it was an annoyance before. That's a great way to put it. It was, and it was something that was constant because how many times a day are you changing your clothes and tuck everything into the underwear and now I can wear anything and just don't even think about it anymore.
Yeah,
Hmm.
and that's just quality of life, right? For
Yes.
something that's pretty easy.
Hmm.
So, what would you say to someone who's maybe been suffering with this and might have been hesitant or scared to reach out for help?
Don't even think twice about it. Do it. It is 100% worth it. Um, I was lucky that I had you. I trusted you to do the procedure. I wasn't concerned about that at all. So I would say, yeah, I would say just do it. It's going to be your quality of life is going to be so much better afterwards. And honestly, the recovery time is nothing. And it just makes things seamless.
Yeah, well,
Hmm.
that sounds like a big improvement that a lot of women could benefit from.
Yes.